So I'll talk about another surgery that I specialize in besides knee replacement and hip replacement. This is arthroscopy, where a keyhole surgery is done. This is very different injury. This is commonly seen in youngsters, 20-year-old, 22-year-old, 25-year-old, 30-year-old. Have you ever heard of ACL? ACL tear, ACL tear. It's a big ligament inside your knee that connects the bone above and bone below. Now, if I'm moving like this, there should be some connection, right? Inside my joint, bone cannot rub on the bone. The main hinge, the main connection between the thigh bone and the leg bone is called ACL, and unfortunately it is the commonest ligament that breaks. So see how God has given the body. He has given things at good places, but if you don't maintain them well, you can tear them. So this is called as a sports injury. So it can happen while playing volleyball, while playing basketball. So I operated a patient last week. He was jumping the gate, December 31st. He came late from a party, 22-year-old. He was jumping from the gate and he broke his ACL. Right, so these things can happen. So life can turn from completely stable to utmost crisis in one night. That's why you should have insurance. In the hospital come down, the expenses don't increase twofold or threefold. They remain the same. But you give the best to your patient. To get the best results, you have to give bed. Everything has to be good. Right surgeon, right patient, right timing, right result. If anything is wrong in this, the result will be wrong. Right surgeon, right patient, right timing of operation gives right result. So all four should be right to give a good result. Next. Thank you. So this is the first video where, play the first one. So you can see what happens in an ACL tear is, like I said, the big hinge that is connecting your thigh bone and leg bone is broken. So the knee will become loose. So how loose will it become? Just watch that video. I'll show you how loose the the knee will become after the ACL tear. Please watch that area closely. This is not a normal patient. This is not a normal knee. Now look at it. See. So this is what happens in an ACL tear. Right? Is this normal? So whenever you hear the word ACL next time, this should flash in your mind. This is the implication of ACL tear. What it does to a 20-year-old. Can he play with this kind? He'll buckle. Can he jump? He'll buckle. Can he walk the entire day in the mall with that kind of a knee? No. So these is the emotional aspect should come into mind, that this is the problem the patient will face with an ACL tear. Next slide. So after the operation, what happens after the ACL operation? Next slide. So first video. So this is a small operation which is done in 35 to 40 minutes. In the beginning, in 2014, 2015, we used to take 3 hours. Now we finish it off in 35 minutes. I order my coffee. Before the coffee becomes cold, I come out. Right? So this is what happens after the operation. It is done with small cuts. It is not an open surgery. It is called keyhole surgery or arthroscopic surgery, just like laparoscopy. One cut here, one cut here, one cut here. 3 small cuts, and 35 minutes later, the patient will get a stable knee again. He can go hiking, he can go trekking, he can play volleyball, he can jump from the gate again. He can do anything. Right? Next. So this is, again, I am showing the number of cuts there. 2 small cuts above and 1 medium cut below. About 5 to 6 stitches, the entire operation done. So what else do I do? Right? I do knee replacements, I do hip replacements, I do arthroscopic surgeries. What else do I do? Many of you might have come across your client calling you at odd times and saying, "Yaar, accident ho gaya." Yes or no? Right? Road traffic accident, fall in the bathroom, some assault, somebody is hit by somebody, some MLC, some medico-legal case, some litigation. Something like this also can happen. Play the first video and watch very closely. Watch very closely. This person has fell from 40 feet from a lift. Start. Yes. Can you see that? Can you play again? He had insurance. Right? And he was operated the same day. Go back. Go back. Yes. Can you see that? He fell from 40 feet height from a lift which was under construction, very close by in Medipatnam, and he landed up to me with two broken bones. This is the biggest bone in the body. The thigh bone is the biggest bone in the body. It is also called femur. Both the femurs are broken. He's 21-year-old. His entire life is in front of him, and he landed up with two broken femurs. Just because the lift was faulty, under construction, he fell from there. Watch this video. Watch this video. You see how he has fallen down. So this footage was sent to the patient himself. Once he got better, this footage was sent to me from the patient himself. Sir, I have a CC camera recording. You should see how I fell down. So now, are you curious to see how he is now? Yes? Go to the next slide. Play the first video. So this is him at 3 months. He's sitting cross-legged. He's a Muslim patient. He can do sajda, he can do namaz. Now he is in UAE. He's making 3 lakhs a month in Indian currency. Right? So a surgery, right patient, right doctor, right timing, of course right agent, gives right result. Right? Next. So this was his broken thigh bones. The first X-ray is the X-ray before the operation. The second X-ray is the X-ray of the left leg. The third X-ray is the X-ray of the right leg. Right? And we put a intramedullary nail. I think you might have heard of ORIF, open reduction internal fixation. Right? This is one of those operations where we put a rod with small cuts. This is not a cut where from here to here. Small cut here, small cut here. So these days, there are a lot of advances in the orthopedic operations. We don't cut a lot anymore. Right? Next. So this is all the patients that I cater to. All the videos are on my YouTube channel also. This is my YouTube channel. You can take a picture if you want and play the video. So it is important to educate the patients also. So I make a lot of videos. All the videos are on my YouTube so that a general patient gets answers to unanswered questions. Like the doctor doesn't have time to talk so much in front of one patient. So most of the answers you will get here. Knee replacement, hip replacement, ACL and all that. Right? Next. So I'm Dr. Sidhartha. I'm trained from AIIMS Delhi and PGI Chandigarh, which are the best institutes in the country as on today. And I do knee replacements, hip replacements, arthroscopic surgeries, complex fracture surgeries. And you can think of us whenever your near and dear ones end up with this kind of situations. And I am available in Gleneagles Global Hospital. Next slide, please. I'm available in the hospital, which is just on the other side of the road, from 10 a.m. to 3 p.m. every working day. And I also have 2 clinics in the city where I sit from 4 to 7 and 7 to 10. And I thank you everyone for giving me the opportunity. I thank all the dignitaries. For lower limb polytrauma, do I do Ilizarov? Yes and no. I will not do like this case of a 21-year-old young boy. It is a polytrauma. Polytrauma means there are 2 or more than 2 injuries. Head injury, abdominal injury, chest injury, and limb injury. Ilizarov is a salvage operation. It is only done for neglected cases, bad cases, 1 or 2 or 3 failed operation. If the first operation is right, you don't need second or third or fourth. It will reduce the burden on the insurance company. It will reduce the burden on the patient also. Insurance cannot give approval for every surgery that is done every 2 months. Do only one operation and get it right. Don't do again and again and again and again. Only one operation and do it right. Finish. End of the story. That patient should not come back to the theatre again for the same problem. Right? Oh. Yes, sir. Yes.
Jose, do you think it needs applaud? Yes, louder, louder, louder. Just give a standing ovation. How it is. Thank you very much. Last speaker, one speaker.